all of these studies looking at type 2 diabetes, type 1 diabetes, different types of medications, different types of treatment, whether you, if you were on type 1 diabetes, whether you are on a pump or not, all these clinical research studies use the hemoglobin A1c as the measurement of whether or not control was achieved. And so one then could look at the measurement of whether a patient was controlled with a hemoglobin A1c as compared to uncontrolled, and whether or not the complications were worse in one or the other. And all of these studies showed that hemoglobin A1cs at a certain level gave us the protection, so to speak, or gave us a lessening of the likelihood of a complication of diabetes. So that's what really the hemoglobin A1c is about, is it's trying to look at whether or not one's going to develop the complications of diabetes. And those complications include eye disease, retinopathy, kidney disease, nephropathy, or disease of the peripheral feet, which is called neuropathy. And then, of course, we are all aware that diabetes increases the risk of heart disease. And so, again, these measurements of hemoglobin A1c are looking at trying to maintain the likelihood that one would not have complications, assuming that their hemoglobin A1c was in a certain range. And so that's why hemoglobin A1c is important. That's why we measure it, and we look for levels that are in the 7 or below range in certain individuals.